My name is Olivia Ellingson, and I'm a PA student. I'm going to be doing a physical exam on you today. As I wash my hands, can you verify your name and your date of birth and age?
James Ellingson, 12/6/63, and I'm 62.
Okay, and I'm going to be doing a physical exam on you today, so just taking vital signs, doing a lot of blood pressures, and a lot of physical exams. So is it okay if I proceed with that?
Yes.
Then I'm going to assess for the patient's general state of appearance. He's looking alert and responsive, and his level of consciousness is he's conscious. I'm then going to also state if he's looking ill, if he's looking fit, if he's looking robust, any sort of general state of appearance. So he's looking normal. So I'm just going to ask you some orientation questions. Where are you at today?
I am at the upstairs clinic and underway.
And can you verify your name and date of birth too?
James Ellingson, 12/6/63.
All right, and do you know why you're here today?
Very well, check.
And do you know what day of the week it is?
Yes, Saturday.
All right. Then I'm going to be looking for any signs of physical distress or cardiorespiratory symptoms and anxiety or depression. And then I'm going to be looking over the patient's hygiene and grooming. That looks normal. I'm going to be looking at his facial expression. I'm going to look for the patient's odor, any sort of odors or body odors. I'm going to look for the patient's, look at the patient's posture and any sort of MSK or skeletal symptoms. If he's any sort of abnormal movements, posture's good, all is well. And then I'm going to be looking at the mood and effect of the patient. So any emotions that he's having, any moods. And then I'm going to be looking at his speech, language, and his thought processing. All right, I believe that's it for the general state, or for the general exam. Now I'm going to be taking the patient's vitals, so I'm going to be doing his height, weight, and BMI. And then if I were to do the temperature, I could do it through the tympanic membrane or the temporal artery, or rectally for core body temperature, or orally. So now that I've done that, I'm just going to be doing, let's see, respiratory rate. All right, so I checked the patient's pulse rate and respiratory rate. His pulse rate was around 18, and his respiratory rate was 9 breaths. So for the pulse rate, I'd multiply that by 4, and then for the respiratory rate, I would multiply that by 2. I did the pulse rate for 15 seconds and the respiratory rate for 30. All right, so now I'm just going to be taking your blood pressure. All right, so I'm just going to roll this up, and then make sure your feet are flat on the floor. They're not crossed. so his blood pressure was around 128/70. All right. Let's see. I'm gonna have you. Actually, so I'm gonna hold your arm up.
Okay.
All right. So I'm gonna.
This one?
Yep. This one as well. Make sure it's okay. All right, I'm actually just gonna put this pillow right underneath so you can hold your arm up.
Okay.
There we go. All right, and the patient's blood pressure was around 125/75.
Is that pretty good?
All right, and good. So now we are going to, I'm gonna have you just lay across here and we're gonna do an orthostatic hypotension
Okay.
blood pressure reading. So I'll just have you lie flat on your back and then I will take your blood pressure.
You want me to lay my head down this way?
Right here would be
Okay.
perfect. There we go. All right, so now I would have the patient lie completely flat on his back for around 5 minutes. And then I'm going to assess his blood pressure after the 5 minutes while lying down, and then I'm going to do it at 1 and 3 minutes after that, and then measure the systolic difference and the diastolic difference. All right. Okay. I'm just going to roll this up.
Oh, yeah.
All right. This thing's too tight. Oh my god. There we go. Okay. All right. Just gonna put this here. Can you hold this for me for a sec? All right.
Keep my arm down here.
Yeah. There we go. Oh. Okay. All right. And that one was 121/79. So good. That's good.
Oh.
It's going
that's good.
down. Okay.
Okay.
So now I'm going to have the patient stand up. So I'm going to have you stand up. And then I'm gonna measure his blood pressure at 1 and 3 minutes. Okay. Actually, let me do this first. I'll have all of this. I'll have all of this right.
Mm-hmm.
Thank you. Okay, just for a sec, hold that. Okay. All right. Hold it. Yes, that's fine.
Oh, okay.
It's hard because you're so tall.
Hmm.
Oh, it's not.
Yeah, turn the wrong way.
All right, and that one was around 120/80. That was pretty precise to 120/80. Now I'm just gonna get a little bit of air out, and then I'm gonna do it one more time at 3 minutes. So, yep.
Okay.
Just act like that's 3 minutes. Okay. All right. All right, and that is all for today. So thank you.
Okay, thank you, Olivia.